So the first thing I want to say is there are a lot of things that, we don't like about getting older and how we look, but I really think the most devastating thing for both men and for women is hair loss. I had been suffering from hair loss for quite a while and had tried all the tricks, the right hair part, the right products and everything without much success. And then finally I talked to Dr. Chasin about it here at Reflections.
So a lot of patients will ask, well, what happens during the consult? During the day of consult, we want a patient to come in and give us information about their hair loss. When did it start? Is there a family history of hair loss? What medicines are they taking? Could there be medicines that are indeed causing the hair loss? Has there been some kind of traumatic event in their life that triggered this problem? Have they had general anesthesia recently? Many different things can cause hair loss, and we want to try to figure out what that cause is. Second thing, we want to take a look at the scalp. We want to see if the hair follicles are gone, or if the hair still there, they're just thinning and becoming less dense. We then want to do an actual photograph of the scalp and do a measurement to try to identify what percent of hair loss has occurred already. And this may be different in different parts of the scalp. So we want to look at the crown of the head, we want to look at the temporal aspects of the head, we want to look at the top of the head and identify where that problem is most advanced and where we're catching it earlier. With that information, we'll pull things together and create a treatment plan specifically for that patient's needs. What are needs mean? Needs may be how much time do they have at home for therapy. The needs may be that a patient doesn't want to put anything to treat themselves in their scalp. The needs may be financial constraints, time constraints, a lot of different factors. So there's not a patient around that doesn't want denser, more vibrant hair.
After my first treatment with PRP, Dr. Chasin did not set high expectations. He told me to be patient, that it might take a few treatments before I saw results. Well, 3.5 weeks after my first treatment, my hairdresser noticed new growth coming in. She looked at me and she said, "What are all these new little hairs on your head?" I got so excited. And then I came here for my second treatment, and after seeing side-by-side photographs, it was true. I had already had new hair growth. Dr. Chasin was really clear on setting up my expectations as how the process works, and it was really pretty simple. You come in, it's about a 1 hour long process, your blood is drawn a very small amount and it is spun so that they can get the platelets out of it, and then those are injected into your scalp. It is a little uncomfortable, but by the time the procedure is over, you feel absolutely no pain whatsoever. You go home, you wash your hair like normal, you can color your hair a day or two later. There's no real impact on your lifestyle. And then all you do is wait about 4 weeks until you have your next treatment.
A patient's individual care plan is the result of advice that we're giving as physicians, coupled with what a patient is amenable to doing at home.